Hi, I'm Dr. Fred Ramos, obstetrician and gynecologist, currently practicing at Kaiser Permanente, South Sacramento, California. I completed my residency training at the Tulane University Medical Center in New Orleans, Louisiana in 2000 and became trained in the use of robotics in 2009. My current practice consists of performing complex gynecological surgical procedures using the Da Vinci robotic platform and training other physicians new to robotics. Will a hysterectomy cure my chronic pelvic pain? Chronic pelvic pain is a very complex entity, potentially involving many different organs and organ systems, such as the uterus, ovaries, bowel, bladder, deep pelvic nerves, and pelvic muscles, as well as fascial tissues. A hysterectomy may or may not improve chronic pelvic pain, and a detailed consultation and physical exam with your physician will help you make that final decision. I have abnormal and excessive monthly bleeding. Should I have a hysterectomy? Excessive and abnormal bleeding is a very common presentation for patients desiring surgery in my practice. Even though a hysterectomy will definitively stop your bleeding, the decision to undergo a major operation should never be taken lightly, as there are surgical risks as well as other options that should be considered first. Also, certain procedures such as an endometrial biopsy may be necessary before proceeding with a hysterectomy to ensure that your bleeding is not associated with uterine cancer. Will a hysterectomy cure my migraines? Migraines associated with the menstrual cycle, or menstrual migraines, are a common cause of loss in productivity and absenteeism amongst a great number of patients. It is then expected that most patients with menstrual migraines would just want their uterus gone as a potential solution to their problem. The reality is, however, that menstrual migraines are mostly hormonally mediated due to a sudden drop in estrogen and progesterone with the onset of menses, and a hysterectomy will likely not improve the condition in the vast majority of patients. The treatment for menstrual migraines continues to be medical, not surgical. I am tired of having my monthly period. May I have a hysterectomy? Even though having your cycle every month may be difficult and sometimes even painful, a hysterectomy should not be viewed as a solution to this inconvenience. There are some patients, however, whose bleeding is so heavy, painful, and long that their lifestyle and overall health may be jeopardized. There are a number of medical options, as well as minor surgical options, that may improve your quality of life by decreasing the amount of bleeding and other symptoms you may be experiencing on a monthly basis. But hysterectomy may be necessary for some patients. This is why it is very important to talk openly and honestly with your physician about your cycles, especially if you believe they are too painful or too heavy or have become this way over time. I feel like a crazy person. Will a hysterectomy cure my emotional roller coaster? Emotional lability, otherwise known as the dreaded emotional roller coaster, is mediated by hormonal changes that occur normally during the monthly cycle. Sometimes the mood swings and irritability can be so severe that patients may require counseling or even medications to help them find a happy balance. A hysterectomy will not cure these mood swings and may even actually make them worse by creating feelings of guilt or regret after the surgery. If you feel like your emotions are getting the best of you during certain parts of the month, talk to your doctor.